Yes, sir.
All right. Okay. So Dr. Rajiv is a brilliant person. I'm not saying the student. He's a very nice person by heart.
Yep.
Because I
So
get to
kind,
know about
sir.
that like after talking with him, and I'm really blessed that Dr. Rajiv has made it through. And I was really tense about his result, but Alhamdulillah, he passed the exam from June, Mumbai, right?
Yes, sir.
Okay, brilliant. So here we have some of the queries that you might mention during your success story, and also you have already mentioned some of those things into your very nice short videos that we have seen that, but
So,
we'll be like seeking some of the more information about that. Okay,
sure.
so all right, so it's all yours, Dr. Rajiv. Okay.
Yes, sir.
Whatever from where you want to start, it's up to you. First of all, you can mention your name, from where you are, when you have
Okay.
completed your part A of MRCS, and then was it your first time attempt for your part B, or is it the second time? And also, for how many months you have prepared yourself for this exam, and what are the study methods you have used? Is there any courses that you have taken? And finally, what are the tricks you have followed to pass this exam? And do you have any recommendations for our future candidates that can follow? Okay.
All right, sir.
All right, go ahead.
So, good evening, everyone. I'm Dr. Rajiv Colaco, and I'm an orthopedic surgeon by profession, and I hail from Mumbai, India. So, starting about my MRCS journey. So, basically, now I started my MRCS journey like really, really long back. This was September 2018. That's when I gave my part A for the first time, and I passed in the first attempt. So thereafter, I gave my Part B attempt, first attempt in Jan 2020 in Hyderabad. But that time, I wasn't really prepared, and I didn't have any idea. I didn't have much of an idea about this MRCS Part B. I was just getting some input from friends, colleagues, and all that. That just take this XYZ notes and read, and just within a month, and you'll be able to pass. There was no proper guidance or anything whatsoever. So with that lack of preparation and overconfidence and whatnot, I went for the exam, and suffice to say, it was an absolute disaster. I wouldn't want to go into the details of it because it's just not worth it. It's a waste of time, actually. And then after that, I thought maybe chalo, I'll join some coaching or something. By then, I found out about some coaching, some Middle Eastern mentors and all that. And I thought maybe I'll join a coaching center. But unfortunately, because of the whole COVID situation, which happened barely like 2 months after my attempt, things didn't, turn up well. So 2 years just went in COVID, absolutely went in COVID. And by then, I had just lost that enthusiasm and that zeal to sort of study and, do anything about it. I lost hope completely. I was like, let's just get done with this. I mean, I don't want to appear for MRCS. But, at the same time, it was my brother, my family members. They were like, they sort of pushed me. They were like, now that you've started it, might as well finish it. You still have time. So I thought about it, and the realization of it came earlier this year. This was in, I think, in the month of Feb 2024, when I said, okay, chalo, I'll give it a shot maybe. But I still didn't have any idea about what to do. So there was this hands-on course organized by some Indian mentors at Hyderabad where I went, and there I met one of my old colleagues and friends from the ortho department, Dr. Amit Patil. He also happened to be a student of IMG. He recommended me this course. Actually, he's the one who started me, like, who told me about this course, IMG, about Dr. Atik and his classes and his materials.
Yes, Dr. Amit was our candidate. Yeah,
He was
very
actually not
nice
the
person.
main candidate. No, I think he was for that for the mock drive. I don't think he was for the main
Yes,
course,
yes, it
if
was
I
a
understand.
long way back.
Yeah, yeah, yeah. So I think he passed this year in Kerala, April. That's what.
Hmm. Hmm.
Yeah, yeah. So anyway, he told me about it, as well as there was Dr. Rajdeep. He is the one who joined before me, and he said it's worth it. Join. So I was like, okay,
Hmm.
I'll join. And then I contacted you, and the rest is, as I say, is history. It was in
Hmm.
the middle of March when I joined your course, and by then
Yeah.
I'd already booked my attempt for the
Hmm.
Part B. And when I started and I saw the course, I saw that it was really nice. I mean, the way you were explaining things and, everyone asking the smallest of doubts, including me. I used to stop you at almost every other class. I used to stop you and ask you, sir, what this, and you used to always oblige. That's what I really appreciate about you, sir.
Thank you.
The smallest things that you always, from the biggest thing, the most, the toughest thing, you'll break it down into small pieces and you'll explain it, and then make sure that we understand. That is what is really appreciable about this particular course.
Mm.
That is the unique, selling point of this course for sure. That you have a mentor who's down to earth, who's ready to answer you at any time. So that's a plus point. And yeah, so I attended this. It was like by the time I started the course, it was already way past. Like anatomy and critical care almost gotten over.
Mm.
And I attended whenever I got time, I attended live classes. But at the same time, you can always go back to the recorded classes. That's another advantage. The recorded classes in the Google Drive, very good. Good to sort of like revise also. And also one more thing, when you attend these classes, make sure that you have to write down these notes. Like whatever sir says,
Mm.
important things, write down. This carries, I think, more importance than the actual. The PDFs also, they're very elaborate and all that, but I think the notes are like the concise form of things which will help you, especially when you do your revision and all that, for sure. And I
Mm.
made I made notes of all the live and recorded classes. About 2 or 3 books are there full of notes only of each and every class. Two,
Really?
three books. Yeah, yeah. I mean, I'm old school. I prefer writing and all that. So
Me,
it's all
me,
about
me
that.
too. Like before my own exam, like if you see or go through my own notes, like it's just writing and writing and writing.
Yes. I mean, we belong to the generation. We're still
Yeah.
not yet in the old.
Yes.
Yeah.
Yes. Yes.
Anyway.
Hmm.
And the thing is that is one more thing. It's not just watching the videos and
Hmm.
making notes and all that. You
Hmm.
must make sure that you practice with a study partner. Very important. Always have a study partner with you, both for knowledge as well as skill. I was fortunate enough to have study partners both from this very same course. One of whom is already sitting here in the course right now, Muni Verma. He's
Oh,
my
Muni.
yeah, Muni
Okay,
was my study
so Muni
partner. Yeah,
Verma is always he's also a brilliant person.
brilliant, absolutely
Very
brilliant.
nice. Very
Very,
nice.
very brilliant partner that I had. I was fortunate enough to have him as my partner, for sure.
Oh.
Yeah, so that way. I mean, it was good. I had Muni and I had Gaurav also. Both were my really good study partners, and
Hmm.
like, because of them, I really credit them as well for this result, for sure. Because we practiced the portion repeatedly, at least twice, maximum thrice in a few stations, and
Hmm.
that really gives you the edge. Practicing is important. Practicing, whether even if you don't have a partner, you can always practice. Is especially the skill part. I think it's always best to sort of catch, maybe a colleague or maybe a ward boy or some, especially for the examination part and all that, or maybe a family member, preferably if someone is a doctor in your family or anyone. Just practice history and examination. These two have to be practiced, and communication as well. Procedural skills, well, it's always best to have a go with the videos that the sir has put up, as well as the, yeah, and always make sure that the pattern, the whole, you have to act it out well. Very important to act out things more than the actual, knowledge stuff that you, like, you probably display. Its main thing is about acting, professionalism, empathy. All those points are important when it comes to the sort of the skill part. No doubt about it. That sort of, I think in my experience, in my exam experience, that played more of a role than the actual knowledge part.
Hmm.
If I really think about it, if I really think too deep about it, and if I think retrospectively, it's that's what worked actually in my favor.
So, one thing that might be like all the candidates might be thinking, like, how did you have guys practice, like, via online or like, live? You got maybe Muni Verma is living somewhere and you are living somewhere
Yeah.
else, right?
So
So, how
Moni,
you guys were like managed, like, or how many times, or for how long you guys have practiced together? Like, maybe you can put some the light on those things as well.
yeah. So we practiced. Like, see, the thing is that I started studying with them maybe in the beginning of May. My exam
Mm-hmm.
was in the end of June. So beginning of May, I started studying with them. Virtually every other day, we used to study for at least 2 hours in the evening, like after our work.
Mm-hmm.
And, Then we started doing it. We were doing it online because they see Moni lives in Lucknow and my other partner Gaurav lives in Haryana. So
Okay.
and I live in Mumbai. So it's all online. Everything was online,
Okay.
practically online. And
So,
even
and one more question, maybe the candidates are having in their mind.
yeah,
So first of all, you have gone through the class or class recordings, then according to that, you are practicing with your partners. Is it so, or something like
yeah,
that, or you
at
guys
least
are practicing something different?
no,
Like
we used
what sort
to
of
see.
things?
We like see at least what I used to do, I used to go through the
Hmm.
classes,
Mm-hmm.
take down the notes, and then
Okay.
even sort of read the PDFs or the I had the hard copies which I ordered from you. I used to
Hmm.
read that and the class notes together and just practice it out with them. That's the way
Correct.
I did it. Yeah.
Correct. Okay. So, and for the practice, you have gone through for all the aspects of the uh, this part B, right? Like starting from anatomy till the communication, all the segments,
Yes,
right?
yes, yes,
For the
yes.
knowledge, for the skills, everything, every
Yes,
stations. And
yes,
you
yes.
say like at least two or three times just by
I
the
think two for
practice
sure. Two
to,
for sure by practice. Yeah, yeah, mainly by practice.
okay.
Self study also was there, no doubt about it.
Hmm. Hmm.
But a good, I can say the major
That means,
contribution came
isn't
from
it
practice.
like Dr. Rajiv, like you have studied by yourself, right?
Hmm.
First of
Yeah,
all, you have maybe you have joined the live class, or maybe you have seen the recordings. That's number one.
yeah.
Okay.
I
Next, you
started
have
that.
studied.
I
Next,
started
you
off
have
that. Hmm.
right. Next, you have studied by yourself. That's number two.
Hmm.
Number third is you have practiced with your partners,
Yes,
correct? And
yes.
maybe you have like you tried to give the mocks as well, or maybe you have listened
I,
to them passively. Yeah.
I see. For the for your class mocks, I've done like
Hmm.
passive listening as well as I've participated in a
Actively,
few.
yes, yes.
Few, very few, but not regular like certain people in the this
Hmm.
thing. Not as regular as them.
I can still remember the communication
Yeah,
aggregation station.
communication
So yeah,
mocks is the things that I practiced with you.
right. Yeah.
So even if you don't have a study partner, I feel this course provides more than adequate opportunities to practice in the class as well as quick revision, which Dr. Esra and Dr. Tanvir organize.
Hmm.
That is like, one of the even if suppose by some bad luck you don't have a partner, I
Hmm.
think these things are good enough to practice and clear, I
Hmm.
feel. Yeah.
Okay.
A lot of them have, I mean, Muni himself has practiced earlier the QRCs with Dr. Esra and Dr. Tanvir, and he has always has a good opinion about it. He said that he's got a lot of
Hmm.
information, a lot of points, you
Yeah.
know, they've
Yeah.
really imparted a lot of wisdom and all that. So that sort of helped, as
Hmm.
well. I didn't do it
Okay.
personally because of time issues. Yeah.
Brilliant. So, whatever the time you have started from the mid of March, and you have
Yeah.
given your exam is in June. So it was maybe
Three and a
three
half.
months or something
Three and
like
a half.
that. Yeah.
3.5 months roughly. Yeah.
3.5 months. Okay, you are lucky. Okay, because why? When I have mentioned during the last class, some of the candidates were saying like, "Wow, only in 3 months, Dr. Rajiv passed this exam." So
I think it's more than
I,
enough.
I, I think like maybe you are going to agree with me in this situation that it is not about the time, right? It's not about the months. It's about the how much concentration you are giving into your
Exactly.
study, how much dedication you are giving into your
Yes.
study, right?
Yes.
And how much practice you have done within that time, right? So
Exactly.
maybe some of the candidates maybe just studying, right? Studying from the notes for months and months and months, and he didn't or she didn't participated for any mocks or any practice with the partners, right? So for
Right,
the
sir.
first 6 months, he or she just read from the notes, and then for the last 6 months, he was just participating. So it took her or him for a long 1 year for the preparation and go for this exam, right? So it's
Right.
I think it's a variable thing uh, about the
Candidate.
preparation time for
Yes.
each candidates. Are you
Yes,
agree
sir.
with me about that?
Absolutely, sir. So
Right?
the thing is
Okay.
that it's more than quantity, it's about the quality. Quality of
Exactly.
study.
Right. Right.
That
Right.
is the
Right.
whole for this thing.
Hmm.
The way you do it is important. Like practice, as
Hmm.
I always say, practice, practice, and practice. That is what will make you perfect, makes a man perfect.
Correct. Correct.
Nothing more. Yeah, yeah.
One more
And
question. One more
yeah, tell
question,
me.
Dr. Rajiv. Then you
Yeah,
can finish it off, no problem.
yeah, yeah, sure.
Um, I'm pretty sure that all the candidates wants to hear like about the exam situation, right? Like
Yeah,
how you are handling the stress.
yeah.
Like what about the exam centers? How are the like the persons who came to take the exams as well, right?
Mm,
Was there adequate foods? Like as a overall, like if you can mention something about those things.
sure. So my exam was on the June 28th. It was at a medical college outside of Mumbai,
Hmm.
called MGM Medical College, and it was at their
It's a
skills lab.
huge and very renowned medical
Medical
college.
college, yeah, yeah. It's a private, very charitable medical college.
Right.
But the thing is that for my session, there were no real patients. They were actors, even in examination as well as,
Yeah, it entirely depends upon the centers, Dr. Rajiv.
yeah, 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 yeah,
Okay.
yeah.
Maybe in that particular time they couldn't manage any real patient which can suit in the MRCS exam. So yeah, it could be.
Possibly.
Yeah.
The center was good. There was no problem where the center was concerned. Maybe people had difficulty finding accommodation in the surrounding areas because it's a little
Mm-hmm.
outside. But I don't
Mm-hmm.
think the center was an issue as such. The things were organized pretty well. There wasn't.
Right.
There was. Like we're talking about facilities. Like they had like you had toilet breaks at the rest station. You had water provided and biscuits. They didn't have food, but they had tea and coffee for that for sure before and after the exam, and
Okay.
everything was very standard. The examiners were standard. I don't think they were like aggressive or anything as such. They were some of them were just maybe one, two sessions were just a bit weird. I wouldn't call them aggressive. Just a little
Okay.
odd. Maybe with
Okay.
the way they were pronouncing things or what, I don't know. But like they're just a little weird. But otherwise I think it was okay. Me personally, see, I didn't sleep at all the night before the exam. I didn't sleep
Which
at
is
all.
very bad.
Very bad.
Which
Very
is
bad.
very, very bad. Right.
I would not
Mm.
recommend this for anyone. I mean, people,
Right.
all of you have to sleep well. If possible, avoid studying the evening before the exam. Just put your
And
books away.
Dr. Rajiv, just to put you in my situation as well, what
Yes,
happened
sir.
is because of the stress, like we went to the for the sleep early, but we couldn't sleep. And sometimes you will not understand whether you are sleeping or you are awake,
That's
right?
exactly what happened to me. Same thing
Right.
happened with
So, so I had that same thing. Like, I went for the bed for like, very early.
yeah.
I was there and I'm confused whether I'm sleeping or like I'm not sleeping. I don't understand. And all of a sudden I thought like, okay, it is 5 a.m. and I have to get up and I have to go. Right. So yeah.
I think the morning session candidates have it worse. Afternoon session,
Very
at least they
worse.
have time to sleep. I don't know whether they'll go to sleep, but at least they have some time to sort of relax and unwind. But we
Correct.
had a tough time. I mean, the morning session people had a tough time.
Right.
Yeah.
Okay.
So apart from
So
that, yeah.
about one more question maybe the candidates are having in their mind. I'm just assuming these questions from the past, like some of the success stories. Like
Hmm.
about the stations, if you can remember some of the stations, like any particular one that you have, like had some difficulties or some of the problems you had. So yeah, like how could have
Yeah.
you cope with those things if you can just mention those.
Well, difficulty, I'll tell you. So we'll think about knowledge. Okay, I'll just
Mhm.
go through, run through everything.
Sure. Sure.
Anatomy, anatomy was fine. It was just like basically whatever, if you
Right.
read Atlas or any like the Logan's Atlas or McMahon's or whatever, if you have those pictures in mind, if you have a 3D image in mind. I remember there was a talk by Dr. Samir Sheikh. He said that if you see Shah Rukh
Yes.
Khan in three different ways, it's all the same. That way,
Exactly.
yeah.
Exactly.
So anatomy basically it's like all in your head. If you know what it is, if you can sort of locate the structure and everything is labeled, if you can identify things and sort of know the applied anatomy for it, that's it. I mean, that's fine enough. For me, it was okay.
Right.
Uh, uh, Pathology, I think two stations. One was malignant melanoma, that a cancer one, and one was I think TB, the TB lymph node thing, TB
Hmm.
lymphadenitis, neck.
Hmm.
So everything was straightforward, I think, for the TB thing, except that maybe that labeling of the specimen. I don't know what he wanted. I said exactly the same thing that you mentioned in the class.
Mm-hmm.
you know, but
Mm-hmm.
regarding the name and the barcode and all that stuff. But I don't know, he sort of didn't really look, he had a very poker face. He didn't accept the answer, maybe.
Yeah.
But apart
Yeah.
from that, everything, I don't know why whether there's a problem with that. I don't know, but that will have to be looked into, I think.
Yeah.
And apart from that, malignant melanoma was basically all theoretical stuff he asked me. And then he asked me a question about tumor regression, which I
Okay.
think is a new question. I don't. I mentioned a few things here and there about tube that we asked about tumor regression. What exactly does it mean? So I said it regresses back to its sort of normal or pre-normal state. So how does it happen? So I said probably the effect of chemo and radio and all that. And then he asked about what else? I said maybe possibly the old stimulus might have gone. Then he's like, okay, what kind of stimulus are you looking for? And particularly in the Caucasian population. So I said maybe sun exposure. He said yes, correct. He said yes. I thought maybe he accepted the answer, but I don't know exactly what happened. So
Right.
that apart from
Right.
that, but everything else was standard. They're just going with the flow. Like I answered pretty much everything else about that. In critical care, see, there were three stations. One was polytrauma with liver tear, which was pretty straightforward. I don't think there was anything different from the notes. Everything about ATLS was asked, and they showed the X-ray of chest as well as they showed a what do you call that, CT scan, liver tear, management of liver tear, all those things. Standard questions as per the notes, nothing different. There was hypothermia with this thing, abdominal aortic aneurysm. That station was straightforward, but there were a few things I forgot because of my sleep issues.
Right.
I sort
Right.
of like maybe lost my sort of composure at that time. Maybe lost a few questions. That's where I probably lost a few marks as well. But I
Mm-hmm.
think that was a pretty straightforward question. Otherwise, there was nothing wrong with it. There was another station that was a this thing pain management station. Now the thing
Mm.
about pain management station, they'll show you sort of visual analog scale. The patient has moderate pain thing, and then they'll show you a chart. Now the chart looks very different from what we normally write in our orders in India, Bangladesh, subcontinent. It's an NHS, typical NHS drug order chart, which you'll have to sort of familiarize yourself with. Only then you'll be able to
Correct.
make up what drugs were given and
Just for a quick thing for all the candidates who are here, you guys
yeah,
can just simply search into the Google about that NHS drug chart, okay,
yeah,
and you will have a lots of like similar drug charts. So you guys can just go through those things just before your exam. It will be, I think, a little bit helpful for them.
yeah. That is important. And the rest of the questions that he asked were pretty much standard. I think I don't think he asked anything deviated, anything from that. Thing was that I was looking at the chart for a long time. That's why I lost time. And then towards the end,
Hmm.
whatever questions were asked, I missed out, and that's the end of the station. Then after that, so anatomy, critical care path is over. Now we are going on to the skill part. Skill part, history taking was pretty straightforward. One was abdominal pain with vomiting. That was acute pancreatitis. That was okay. Only thing is that I didn't go deep into the management because I was stuck on the. I finished up the history taking in time. No problem about the history taking, counseling the patient, everything fine. But
Okay. So Dr. Rajiv,
yeah,
the some of the candidates, I'm not saying
yeah,
all of them, but maximum of the candidates, they have one queries like during the mocks, during the maybe QRC, during the practice session with the partners, they
mm,
don't have that much time where they can finish their history taking. I
right,
said like, see, during your exam, all the actors, right? All the patients, they will be actors, and they are well organized, and they have been well instructed, and they know how to finish it off within that particular time. If you know exactly what is the structure you have to go through, am I
yes.
correct?
Absolutely. And
Okay.
whatever you have taught us in the in the history taking part, that has helped because fixed questions, most
Hmm.
important, fixed question. No need to go on and about what has been said. We
True.
fix those
True.
questions, ask those questions, finish it off.
Finish it off.
And
Yeah.
somehow reach ice. Most important part, I think, is to reach ice. Kaise bhi
Yeah.
karke, finish off ice. And
Right.
I think that's it. I mean, that's the main thing. The discussion part, presentation, only positive findings. And the management part, if you are somehow able to complete even a wee bit of it, I think this shouldn't matter. Like the way it
Yeah.
didn't matter much to me. I for the pancreatitis part, I was like elaborating more on the what do you call that, the radiological findings on CT. That's when the bell rang, and that's it. Yeah.
Hmm.
And surprisingly, the next station that was BPH, which is supposed to be a very long station, I finished it. second semi karke I finished it. I don't know how I did it, but I
Hmm.
did it. And it went well. Again,
Just could you remember that sequence
I
of the
right now I don't
BPH?
remember the sequence. No, but I could remember what you had meant. This thing, the whole thing about like the patient, what do you call that? Urgency, hesitancy, frequency, all
Yeah,
that.
that's what I'm
Step by
saying.
step,
Like the
step by
patient
step.
is
That was
having, yeah,
yes,
the patient is
I
having
could remember.
urging and all that stuff. Yeah,
At that time, I could remember it. Yes, and I right enough told the same way, and I
good.
went according to the differential diagnosis, and I finished it off. I don't know how
Hmm.
I did it, but I did it. And that's it. But the discussion part was more on differentiating which test is definitively useful to differentiate whether it's a BPH or whether it's a CA prostate.
Hmm.
He went with, I was answering one test after the other, and finally he wanted the answer of transrectal ultrasound with biopsy. So I went in that, and that's when the bell rang, and that's it. I didn't go to
Hmm.
TURP. That's it. Yeah, that was it for history. Then came examination. Examination. So, by the way, sir, one more thing I want to say. There's no particular order in our exam. There was no order
Yeah,
of.
it entirely depends upon the center. As I said, it could be
Yes,
like a knowledge part, skill part, or it could be scattered.
yes, yes. It was
Okay,
all scattered. One
right.
knowledge, one skill, maybe
Hmm.
two skill, one knowledge again. It was just
Hmm.
mix. Random it was.
Right.
Examinations I had ankle. Ankle was pretty straightforward for me.
Hmm.
Orthopedician, so nothing wrong with that. Everything was fine. Uh, Submandibular gland swelling was a normal patient, so I presented as a normal case, and I said I would like to rule out the others, that is sialadenitis and osteolithiasis and neoplasm. I went that way. I did
Hmm.
everything as per the whatever was mentioned in the video as well as the notes, but he still wanted something else. I don't know what, honestly.
Hmm.
He was like, "What else will you do?" After everything was done, presentation was done, management was done, everything. But he wanted something else. I still can't remember what he wanted. I tried to really recall, but I couldn't, honestly. That is
Okay.
one thing. Then the third question was crisp, abdomen
Hmm.
crisp, anastomotic leak. That from the
Beautiful
stem,
station.
yeah, you can make out from the stem only. The stem
Yeah.
itself is so elaborate that
Hmm.
the patient was post-op day so and so, maybe 8 or whatever, and he's had sudden abdominal, outside abdomen pain and shoulder tip pain. That itself should give you a clue that it's a crispation.
Hmm.
And I went according to the same thing. Like, the patient was, I started the same way as you had mentioned in your videos.
Hmm.
I did superficial palpation. He had left iliac fossa tenderness and suddenly started gasping. And then that's when I started crisp. Now, in all of that, I did everything. Only thing I
Hmm.
forgot most importantly was bowel sounds, which he asked me in the Viva.
Hmm.
Bowel sounds is very important. That you
Hmm.
must never forget in an abdomen station. And of course, I didn't have the time. The patient had a irregular pulse, and his ECG was suggestive of AF. So as I started talking about the management of AF, the bell rang. So I didn't have enough time to finish that, but somehow
Hmm.
it went okay, I think, possibly.
Yeah.
That was examination. Then came the procedural were two. That is, one is suturing, clean wound. In that, we didn't have to do, mainly the patient was prepped and draped and anesthetized. All
Hmm.
we had to do was the procedure and the demonstration of safe surgical practices, like, disposing of the sharps and all those things. So that was pretty much straightforward. Still, even if the patient is anesthetized, you still have to go and check if everything is
Check.
okay.
Right.
Yeah, do the usual thing. Everything you go as per the same order. Check if the patient is anesthetized. If the patient is
Hmm.
okay to proceed, and walk. And then while doing the suturing, yeah, I asked him about parking. He said it's not required. No need to park your this thing. You talked about parking the needle in one corner. So that,
Yeah. That's why I asked. Like, ask before you do it.
yeah,
Right?
he says,
Because it will depends upon the examiner.
yeah, yeah.
Good.
He said there was no need to do it, and
Hmm.
I did the same way. And of course, the last thing you have to do is throw the thing in the sharp spin, and that pretty much ended it. Then this next station was an abscess station. Now, in that station, you have to wear a sort of apron and then, wear your gloves. Now, wearing the gloves itself took time for me because my hands are big eight
Hmm.
size hands. And the gloves were like probably a 6.5 or a 7. So putting that thing on itself took a long time. I was like, hurry up,
Yeah.
hurry up, hurry up. So I didn't know what to do. I kaise bhi karke I put something. And I went on the usual way. Everything was fine. The only screw up I think I had was towards the end. I don't know why, out of sheer ignorance or just like, absent-mindedness, I mentioned, he asked, I did everything like the typical procedure as explained. I did everything A to Z. I put the wick inside. Now then the examiner asked me, okay, what dressing would you like to give? I should have told plain dressing and I will replace with an alginate. But I said alginate. And then he's like, why? Why alginate? And then the bell rang. Saved by the bell. Oh, it's actually you have to put a plain dressing and then the
Right.
next day replace by an alginate. No, if I'm not mistaken, sir.
Yes. No. Yeah. Right.
That's the way.
Yes.
That's the way it is. So that mistake I made at the end, and the bell rang, and that's it. Then what am I left with? Communication. Communication now, the consultant communication thing was pretty much straightforward.
Hmm.
The
Hmm.
Oligorio post-op day one thing, it was like good. I mean, there wasn't any problem as such. The consultant was satisfied, finished off within 7 minutes, end of story.
Hmm.
Nothing much to really add to that. Apart from,
Right.
and you must always read the chart. Don't depend on whatever was given in the notes. That is one thing. Always read the charts well. Note down important points because what is relevant
Correct.
to that particular scenario, you have to explain well to the consultant, right? And then the communication with the patient. I had angry lady, broken CT.
Hmm.
That the dangerous station, one of the
Yes.
most dangerous
So,
stations of
so tell
communication.
me about that. Like how you have learned from the course and how you have performed during the real exam.
Well, course really helped me a lot. Whatever I learned, I incorporated in the exam. That's all I can
Hmm.
say. And that really helped me. And
So did
practice
you did
also
you did you fall into that trap
of,
of that lady asking,
yeah.
is my husband is having a cancer?
Yes, yes. He asked the same thing, and I told the same thing that you told us to tell.
Correct.
That's
And
not a
then
patient need to know.
what was her situation after hearing that?
She was okay. She was still
Correct.
angry. Not she was not
But
entirely
yes,
calmed down.
like by the time goes, she like has
The
a
exam,
reduction of the
yeah,
stress and everything, right? Yeah.
yeah.
Mm, good.
Yeah, so basically about ultrasound, you have to explain about how that will help
Hmm.
versus in the meantime, what can be done.
Hmm.
Ultrasound, until such time Mr. Man comes, you can wait, and we can
Hmm.
probably do an MRI if required after his approval. All those things and with the help of ultrasound at the same time, we can even, do a tapping and help him
Hmm.
relieve him of his this thing. Then she was asking, like, will it really hurt him? I said, no, we'll use a numbing agent. All that will keep him comfortable as possible. All those things I somehow finished off that way. And yeah, I think that's about it about my exam. Huh? What else?
All
Anything
right.
else?
Yeah.
Yeah.
No, brilliant. Okay. So, as you have said, like all of those things,
Yeah.
such a nice way, and also we have learned about that. So now it's our time. Like, if any candidates want to ask any queries, or if you have any questions to Dr. Rajiv, you guys are most welcome. Okay, you can ask any question, and I hope like Dr. Rajiv will love to give the answer for that as well. Anyone want to ask anything to Dr. Rajiv particularly? No one? Come on, guys, it's your opportunity to have some doubts cleared.
They can always approach me on Telegram also. If they don't have anything now, they can
Yeah,
always approach me later. No problem.
right, right. Okay. Dr. Mustafa, you want to ask something?
Yes, were all the instruments provided needed for the examination, like say stethoscope and other things? If
The equipments, yeah.
See, stethoscope you can take your own as well as they'll provide you registration where required. So nothing to worry about that.
And like Dr. Rajiv, I think Dr. Mustafa wanted to know like what about the like for the CRISP station, all of those things are available, or for the different clinical examinations, are there all those equipments are ready there?
Yes,
Is
yes,
it
everything
is
is
so?
there. Whatever is required for any examination is all available there. There's no shortage of any item. Nothing to worry about that.
One more thing, sometimes I got some queries like, what should you wear before you go for your exam?
Well, for guys, normal formal shirt and trousers, and fold your sleeves above the elbows, or wear a bush shirt above the elbows, and formal shoes. That's it. Be prim and
Yeah,
proper, as you would
yeah,
in an exam in India or Bangladesh or wherever. Same
yeah,
thing.
same thing. Right,
No
right,
apron and
right.
all that. No apron and all that stuff. Just go
No, no,
like
no.
that.
Okay, I want to share one funny thing.
Yeah,
One
sure.
of the candidates, I am not, I forgot the name of the candidate as well, and I'm not going to share that name, of course. That person asked me like, should I wear any like a complete suit with the ties on for the exam? I said, like you can
No,
simply go with
it's
the like
happening.
with the polo t-shirts like this as well with the collars and everything. This is that much casual, right? They are not going to judge us like our subcontinental consultants or the professors does, right? So
Just
yeah,
be
you can.
formal. That is normal formal t-shirt. I will do that.
Right,
So,
right, right. Even I saw some of the candidates from Egypt, they just simply wear like, jeans and these kinds of polos and
hmm.
wearing sneakers, and that's it. And it's well, no problem. You can go like that as well. Okay.
Personally, I wouldn't
So yeah,
recommend it. I'd say go as formal as possible. Just normal shirt pants.
yeah. Normally, yes, yes. Okay, brilliant. Okay, thank you, Dr. Rajiv, for all of your
Absolutely.
time that you
Yes,
have given to us,
most
and
welcome.
hopefully you are going to like help all the future candidates. Okay,
Definitely. Definitely. Yeah, yeah.
inshallah, just be ready for them. And I think your elder brother is also our course candidate, and he's going to give his
Yes,
exam, inshallah.
yes, 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 yes,
Right?
yes, yes. Yeah.
So yeah, brilliant. So thank you so much, Dr. Rajiv, for your time.
Thank you, sir. Thank you
And
so much
if
for
you want
everything.
to, just for your last words, if you want to, do you any recommendations or anything you want to say to the all the other candidates?
Well, all I want to say is, see, don't lose hope. Don't be disheartened. Don't lose that confidence. Just keep practicing and just keep, just keep practicing and studying. That's all. Be, give it your best shot. You'll definitely ace this exam. There's no substitute for hard work and practice. And like I've already mentioned in that small video, if a person like me who has had a 4-year gap and who's lost all their enthusiasm and hope to study can come back from all of that and study, well, you can do it too. That's all I can say.
Brilliant. Okay, thank you, Dr. Rajiv. Yes,
Assalamu alaikum. I would like to ask something to Dr. Rajiv.
sure.
Hello, I'm Dr. Tahsin,
Yeah,
and
that's right.
thank you for sharing your experience.
Yeah, sure.
Actually, I would like to say that the day when he performed at the Angry Patient for arthroscopy session, moment
Yes,
we knew that he's gonna surely pass this exam.
right.
You're too kind, Tasi. Thank you so much.
Right.
Thank you. Thank you for your kind words.
Wanted to ask is how did you utilize the last 14 days, last 2 weeks of your exam? Because we have 2 weeks roughly.
Okay.
Right.
That's
Excellent question.
So, Tasin, basically, you'll have to just revise what you've studied. Don't go for anything new. Revise, revise, revise with your partners as much as possible. That's all I can say. And put in as much time as possible. And practice everything. The flow of everything should be perfect. And I know for a fact that you will not have a problem with it because you are one of those super perfectionist candidates I've seen in the course. So you won't have
no,
a
I'm
problem.
I agree with you,
so
Dr. Rajiv.
Exactly. Yeah, that's what. So
And
Tasin won't have
and
a
she
problem with
she
it.
doesn't needs to be that much perfect as well, right? So
She's already
you can have some
perfect.
ease, Dr. Tasin.
Perfection. Yeah.
what I want to say, I was regular during my medical life too. I had this problem.
Okay.
Just before the exam, I became very reluctant.
Okay. See,
So all the time I'm very regular, but just before the exam, everyone is studying, but I am just so reluctant. I am resting or just seeing
it's
movies.
it's normal. It's normal to be like this. It's happened to me also. I also have to take breaks in between and unwind a bit and blow off a bit of steam. There's nothing wrong with that. It's always good to sort of look after yourself first as well. For you, if you can take a break, no problem. But get back with equal enthusiasm and study well with I think you have partners to study with, right? If I'm not mistaken. Yeah.
We did
Sorry?
not practice the knowledge part. We practiced the skill part. I studied the
Okay.
knowledge part myself only.
All right, fine. Whatever suits you, no problem. But practice the skill part. Make sure everything is perfect at your tongue. I think you'll be okay. Don't worry about it. Just
Okay,
practice.
thank you.
Yeah.
Thank you so much.
Most
And
welcome.
we are hoping to have Dr. Tasin after a few months in the success story again.
Aram se. She will probably be with
Yeah,
us. The station topper also, like the center topper also. If you are, she's that brilliant.
yeah,
That much I can say.
right. Okay. Thank you so much, Dr. Rajiv, for
Yeah,
your time.
most
Okay.
welcome.
Hopefully, we will meet, inshallah, very
Yes,
soon.
definitely, sir. Thank you so
Okay.
much.
Thank